Hey everybody, it is time for me to make a couple of videos that I've been talking in series. I'm not exactly sure how it's all going to turn out because it's all coming out of my head. An overview of what happened along the way over Daniel's life. He's turning 18 on November 22nd, so I figured this would be a good time to, I'll start, I'm not going to go all the way back because that's ridiculous, but we got married in 92 and had our first child in 95. That was Sarah. She was perfectly normal, no problems. We were both working full-time. I had a great career as a human resource manager, finished my MBA just when I found out I was going to have her, so I was like, good, got the master's degree done, everything's cool. We bought a house. And when we found out we were having another baby, we actually found out we were having a boy, and we were so happy. And I remember John went out and bought a little t-shirt that had baseballs on it, you know, so we were like, okay, good, girl, boy, perfect, we're good, you know. So Daniel was born full term, 8 pounds 10 ounces, perfectly healthy. His, you know, appeared to be normal at birth. And back in the 90s, they weren't doing as much in uterine testing for some of these conditions, and I don't even remember hearing about the virus that I'll talk about in a minute during my whole entire pregnancy. So Daniel was born and was doing fine. Looking back, maybe he was a little different than Sarah, because I remember he always used to have like little clenched fists, but you know, you don't know. You think, okay, different baby. That was in November, and then in January of that next year, when he was 8 weeks old, this is where it gets kind of a little strange. Virus called Respiratory syncytial virus, or RSV, which is very common in the winter for babies and little kids and even people, but babies can't fight the mucus. Anyway, Daniel ended up with double lung pneumonia, had to be airlifted out of Danbury into New York, was in critical condition, and it was a really rough time because we didn't know if he was going to make it. The first couple of days were pretty treacherous for him, and he was hanging on. So he did come through it after tons of blood transfusions and just chest tubes, and oh, it was a nightmare. But that was the first significant situation I had ever encountered with hospitals, and I just remember John and I standing at the hospital on the tarmac just watching the helicopter fly off with our infant. You know, it was so traumatic. But he actually had stopped breathing in my arms, so that was probably even more traumatic. They had to shove me out of the room, and then he coded. It was awful. So that respiratory virus was pretty bad, and then as Daniel got better, came home, he was really delayed in everything, and we thought, wow, well, he was just really sick. So the pediatrician was like, you know, when they're that sick, they can have some setbacks. And we were like, yeah, okay, probably. So it just kind of went on, and then we realized he really wasn't progressing developmentally the way that he should. He started early intervention through birth to 3 services at 6 months old because he wasn't sitting up. He was not able to hold anything. He just didn't seem quite right. Now, he was nursing, and he was chubby, and he was smiling, and he was socially very normal, but motor skill wise, definitely something was notably wrong. So we started to see a developmental specialist doctor out of New York. I remember his name was like Dr. Levinson or something. And we started to see a GI doctor because Daniel had really bad reflux. So Dr. Levinson basically told us at our first appointment that something was significantly wrong, and it was probably CP or something related to that. And we were like, what? No, that can't be happening. It just kept getting worse, his motor skills, or the lack of, and eventually we started seeing a physiatrist, we started to see a pulmonologist, we started to see neurology. And Daniel got sick I want to say it was like at about 11 months old. And that's when he had his first full-blown MRI series. We had been thinking, okay, he's delayed, something's wrong, he damaged his brain from stopping breathing. You know, we just were like kind of attributing everything to that respiratory illness. And then the neurologist came in and said, Daniel's brain is not developed correctly. It's too small. It has hydrocephalus, which is fluid in there, and it is originally they diagnosed it pachygyria, which means smooth pieces of brain that didn't develop. Much later on, we found out he actually has polymicrogyria. It's just hard to detect in the kind of a film that they were looking at. It's similar, but yet very different. So it was still a devastating diagnosis because it means severe developmental delay, severe medical issues such as seizures and stomach issues and breathing issues and global motor skill delay. Like his brain was so damaged in the area that controls speech that he wasn't going to be able to talk, and they knew pretty early on. So after seeing all these doctors, we ended up with genetic people stepping on board because they thought it was a genetic link. And that was freaking me out a little bit. So all the genetic testing, oh my God, I went through so much testing. We all did. It was crazy. And everything came out negative. So then we went to Chicago to meet a doctor there, and he diagnosed Daniel with polymicrogyria instead because he specializes in this stuff. Looked at the CT scans and everything much closer. Polymicrogyria is basically little tiny shrunken, not formed right pieces of brain matter. And it was caused by a virus called CMV, Kathy Michael Victor, Cytomegalovirus. Also a very common virus, also spread via little kids. And when we took Daniel to Chicago, we learned a lot that weekend. Or I actually took him myself with the nanny, because we had a nanny at that time because I was still working. It was so cold. It was in February. Anyway, Daniel saw the doctor and was in the clinic for the weekend. They showed me all his different brain scans and showed me the brain scans. I think by that point he was almost 4, of a child his age normal versus his. His brain was definitely much different shaped and small, microcephaly, and you know, clearly he was pretty significantly affected. The doctor said he would probably have seizures, probably have significant feeding issues, probably have motor skill issues, probably develop scoliosis, you know, at some point when he's near puberty. And you know, all of those things actually happened. All those things happened. All the things that they sort of foretold would come along with this degree of deformity. Because just back up a second. CMV can infect a child and not necessarily cause polymicrogyria. But if you have polymicrogyria and your brain is deformed, there are all different spectrums of it. So some kids have PMG and they're able to walk and able to talk and they're just mildly effective. Other kids are even more severe than Daniel, not even able to function in any way. So Daniel was on the higher end of severity, but not the worst case scenario. So the only part of his brain that seemed to be normally protected or seemed normal and intact was the occipital area, which is the part of your brain that controls your vision. So Daniel has very acute vision as a result of that. And early on we thought he had a hearing loss, but it just turned out that after 2 years of hearing aids, he was just not responding to sound. And we took him to the American School for the Deaf for a second opinion, and they tested him so much differently than they did at the regular audiologist. And they said that he can hear, he just can't respond normally the way that normal kids do. And clearly now Daniel can hear just fine. listens to music, he responds, and you can hear him moving around, looking at things everywhere. So that happened. So that was around age 3 to 4. And I know our nanny was still here when Daniel started seizing for the first time, because it was in the middle of the night at 3 a.m. and it was a full-blown, out of the blue, grand mal seizure. Rushed off to the hospital, and I remember that was the first middle of the night rush to the hospital. And it would be one of many, many countless episodes. But the seizure was pretty severe, so we started the whole seizure medicine journey, you know. And the seizures are so complicated because there's all different kinds of seizures and different kinds of medicine, and some of the medicines didn't work, some of them changed his behavior, some of them caused other side effects, and it just was a trial and error for a good couple of years of seizures. And there was one particular seizure, I don't remember what year it was in the early 2000s somewhere, that was status epilepticus, and we had become accustomed to, okay, he's seizing, but we'll get it to stop with medicine at the hospital. We'll get him there, you know, we'll give him the rectal diastat, we'll call the 911, they'll get him there, they'll get it stopped. This seizure, for whatever reason, just kept going and didn't stop and didn't respond to any medication, to the point where they basically put him in a coma and had to put him on a respirator and take him over to Yale. The next day, he came off and he was laughing and giggling at me like there was nothing wrong. So I know it sounds kind of like vague. It's hard for me to remember all the early years because Daniel's almost 18, but they were really hard years, very, very difficult, emotionally trying. It was hard for me because I went from being, you know, this, you know, normal mom with little kids, working. I had a lovely nanny from Seattle. She was really a close part of our family. And then around 2002, my employer decided that they were going to be really nice to me, and they terminated my position based on evidence that I believe to this day was planted. They said that I had seen a memo as an HR director. Somebody was complaining about accounting practices. This was right around the Enron stuff, so everybody was all like, ugh. But I was really not involved in accounting at all. I was a floor plant HR manager, and so anyway, they humiliated me. They sent me home for suspension, and they said they were doing an investigation. Then I came back, and somebody else wanted my job, this other woman at another company, and she stepped right into it. It was a nightmare. Right about a year mark, Daniel had to go in, and it was a January, for double hip osteotomy surgery. This was his first big surgery, other than the G-tube, which they placed for nutrition when he was 2. So that's kind of when I just sort of broke and said, I can't do it. I can't go to work full time and take care of him. It was a 6-week recovery. We were on a waiting list for Medicaid benefits. We waited a good 5 years before he got them, so we were using private insurance through John's employer, and it was not enough to cover everything. So we were struggling financially because we had been so used to having our 2 incomes, and we didn't plan on changing that. And then I had Thomas along the way. Throw that in there. We had another baby, which was really funny because we had always said, 2's good. But then we were on vacation one year at the beach. We used to go to Hampton Beach, and he's like, you want to have another baby? And I was like, why not? We were going through so much, and the crisis counselor and the psychiatrist that we were both seeing at the time, because we were all messed up, said it probably wouldn't be a bad idea for us. We were young. It would be a very healing experience. So along came young Thomas, who was followed as a high-risk pregnancy because they just wanted to make sure he would be okay. And he was like the biggest, most beautiful baby I have ever seen. He was 11 pounds, 12 ounces, and just an amazing baby. Healthy, calm, just I don't even remember him being difficult at all. Probably because I had been through so much with Daniel. Daniel's whole babyhood was doctors and hospitals and tests and back and forth. And I don't even remember him as a baby because I was traumatized. So it was a tough time. And it just continued to be tough. I mean, I don't remember anything ever getting easier. As Daniel got older, it got more complicated because his medical conditions just started to progressively get worse, and then he stopped being able to swallow safely, and he was aspirating, so he needed to be fed via G-tube around age 7. Then he had a stomach surgery because his stomach wouldn't tolerate anything and it was coming back up. So he had a surgery called a Nissen fundoplication, which basically ties off the top of the stomach so that the reflux acid, which was causing a lot of airway damage, wasn't going to be as harmful for him. So that takes us to about age 6. And I think I'm gonna kind of put in some pictures, and that's basically what happened in the early years, okay? So sounds like, yeah, I can explain it so easy now, but we went through trauma when he was sick the first time, just emotional devastation, relationship problems, big time, financial devastation, almost losing the house, all that kind of stuff. Just stress beyond which we should have dealt with. And that's about the time that my fibromyalgia started to appear, was after I had the PTSD from when Daniel stopped breathing. We did see a lot of doctors and therapists, and we worked through it, and it was hard. It was hard. We just figured it out along the way. And I remember that first hip surgery. It was horrible. Daniel was in so much pain. I remember sitting with him going, there is just no way I am going to leave this child all day long and go into an office somewhere. He needed me. And I prayed a lot. And I just figured, you know what? This is it. This is it. This is where I am meant to be. Not in the corporate HR world where I was heading, which I really loved my job, so don't get me wrong. I didn't love the way my last employer discriminated and we almost went to, I had a lawyer and she had all the evidence. I had been collecting things for a couple years that were being said to me behind the scenes, and I had some pretty good stuff, but they paid me a lot of money and told me to go away and be quiet. So if they were actually terminating me for cause, I don't think they would have paid me a lot of money and made me go away and be quiet. So I just left it at that. I just left. I didn't need to go through it, and I didn't need to go through the emotional turmoil. So here we were with an infant, with young Thomas. I think when I was first home from work, he was almost 2. And I was like having a good time with him because Daniel was able to go to the daycare. He had services there. He had all his therapies and home and at school since he was 3 years old. And I was hanging out with Thomas, and it was kind of fun because I didn't have a chance to do that with the other ones. And we did mommy and me stuff and went to gymnastics class and bouncing bears and had fun. We went to birthday parties, and then I put him in preschool when he was 4. I didn't do it when he was 3 because I was kind of selfish. I was like, you know what? I just want to hang out with him because I didn't think I was going to have any more. I wanted more. But Daniel, because a special needs child is so intense, and there's so many things to manage and make sure that all the wheels are turning at the right time and everything's taken care of, and so complicated. And it got worse. But anyway, and then I had Sarah and Thomas, so I just kind of left it at that. So that's sort of it. Daniel's brain is deformed because he was stricken with a virus that somehow I acquired when he was just developing, right after I was pregnant. So the entire pregnancy, he had this CMV, and I never knew it, and they never tested me for it, and no one had any idea, and nobody ever even talked about it. So it was so much later that we found out the CMV had been there, destroying his brain, essentially. It's a bad virus. So I don't know, all I can say is if you're a young mother or you're considering kids, just make sure you know about the CMV virus, do your research, protect yourself and your baby. So that's the early years. And I'm going to some pictures in there, and if anyone has any questions. I mean, the early years are hard for me. I'm 49 now, and he's 18, so yeah, my memory is okay. In some areas and not okay. In other areas, it's like, I can't remember that. All I know is I went through hell, and we had so many doctors. We had like, oh my God, at one point there was like 13 different physicians, you know, that we were seeing, geneticists, developmental doctors, and physiatrists, and pulmonary, and orthopedic, and neurology, and urology, and endocrinology, I don't know. So, yeah. Again. Keep going. Are you a fish? Are you a fish in the water? Are you a fish in the water? You know I'm taping you. You are such a ham. You know it.